Hello, my name is Charlene Brenner, and I'm an occupational therapy doctoral student at American International College, and the following presentation is a health policy analysis of Massachusetts House Bill number 1219. Massachusetts House Bill number 1219 is an act creating higher education opportunities for students with intellectual disabilities, autism, and other developmental disabilities. The bill was filed on January 15th, 2019 by Democratic Massachusetts Representatives Patricia Haddad and Sean Garbali. An identical bill was filed by the Massachusetts Senate, Bill number 756, on January 17th, 2019. The bill was referred to the Joint Committee on Higher Education on January 22nd, 2019. There was a hearing on the bill in June, but the bill remains in committee. The purpose of this bill is to amend the current Massachusetts general law on public education in order to expand the access of higher education opportunities to individuals with severe intellectual disabilities, severe autism spectrum disorders, and other severe developmental disabilities. The bill would remove barriers that currently prevent these individuals from accessing these opportunities, such as not being able to pass MCAS and not receiving a high school diploma. Partnerships would be created between school systems and public universities and colleges across Massachusetts to establish guidelines for admission and the type of supports needed. The bill would facilitate the inclusion of these individuals in classroom as well as extracurricular activities by providing appropriate supports and services to enable student success. The bill has been filed multiple times before, but there seems to be a lot of momentum behind the bill this time around. The Massachusetts Advocates for Children, or MACI, is a strong advocacy group for children and families in Massachusetts. Part of the organization's mission is to provide individual case advocacy and meet with key stakeholders to understand the barriers that children face in education. Advocating for the passage of this bill is currently a top priority of MAC. There is some pushback from colleges and universities, however, due to the mandatory language of the bill. According to Julia Landau, who is a senior project director for MAC, some colleges voice concern about how including these students would somehow delegitimize the appearance of being academically rigorous. This program, however, has already had several successful documented outcomes through the Massachusetts Inclusive Concurrent Enrollment Initiative, also known as MACI, which is a grant-funded version of this program that is available at a handful of colleges and universities across Massachusetts. There are several formal and informal actors who have an interest in this bill. Formal actors include Patricia Haddad and Sean Garbali, who are the Massachusetts House sponsors of the bill, and Joan Lovely, who is the Massachusetts Senate sponsor of the bill. Governor Baker would be another formal actor, as the decision would ultimately be his should the bill make it to his desk. The aforementioned MAC is a formal actor, and this organization has done a great deal of advocacy on MACI's behalf, as well as on behalf of the students and families who are also formal actors. The MACI program is a formal actor, as the passage of the bill would expand this program to colleges and universities across the state of Massachusetts. The Department of Higher Education is another formal actor that would oversee the program's implementation and the formation of an inclusive concurrent enrollment advisory board. Informal actors include state colleges and universities and public school districts that will be required to set up partnerships for program implementation. Social media outlets such as Facebook serve as informal actors in that postings from MAC in support of the bill can be found there. Service providers and support staff of students with disabilities are informal actors that may need additional training in order to properly support students in this setting. The American Occupational Therapy Association and the Massachusetts Occupational Therapy Association are agencies that could provide additional support for the bill's passage as it directly impacts populations in which occupational therapists provide service. Incrementalism is a theory of public policy that can be applied to the decision-making process of this bill. This theory recognizes that there are many actors involved in the policy-making process and predicts that policymakers will build on past policies, making incremental changes. Because this program has already been implemented on a small scale through Macy, the theory of incrementalism can be applied to build on this process. The logic model is another theoretical model that can be useful in analyzing this bill. A logic model can be applied at the beginning phase of program planning, and a logical sequence of cause and effect can be measured by analyzing input, output, and outcome information. For example, the passing of the bill could be viewed as the input, creating task forces to develop guidelines for inclusion of individuals with disability is the output, and the outcome would be that more students with disabilities participate in higher education opportunities. There are financial implications to the passage of this bill, which are an obstacle in its implementation. Public school districts are required to provide programming for students with disabilities until they are 22 years of age. For poorly funded school districts, this may be cost prohibitive. Another barrier is a general lack of knowledge about the availability and benefits of the current grant program. In speaking with Julia Landau from MAC and reviewing past Macy reports, this program could actually save school districts money in some cases. A collaborative day school, for example, can cost an average of $31,000 per student compared to the $6,700 per student that it costs to attend Holyoke Community College. There are long-term benefits to society as well, as participation in the program may open up additional opportunities for these individuals to work and live more independently. The development of transitions is listed as one of the American Occupational Therapy Foundation's research initiatives, and the passage of this bill would create opportunities for occupational therapists to serve in a community capacity as part of the Created Inclusive Concurrent Enrollment Initiative Advisory Board. School-based occupational therapists can provide a unique perspective about a potential student's skills, behavior, and activity tolerance in order to help determine appropriate supports. An additional opportunity exists for occupational therapy students at institutions where there are existing OT programs. Students could become involved in program development, as well as take part in making specific student recommendations under the supervision of their professors. Thank you for your attention and for listening to the information about this important bill.